Hello everyone, I am Dr. Xu. Today I want to share a case about knee injury on pes anserinus. So the history will be like that. 56-year-old female patient who have a left knee injury. For 6 months. 6 weeks. 6 weeks prior. This is the chief complaint. So, for this case, I have the full report from an osteopathic surgeon and an MRI test. So, which means this patient have already suffered from the knee pain for 6 weeks. So during these 6 weeks, she undergone a standard therapy with the GP and the physiotherapist. So unfortunately, have not very good effect. So she was referred to osteopathic surgeon. So this is a report from the surgeon. So the report says it has been almost 6 weeks since she walked into a tow bar with a direct blow injury in the proximal medial tibia region, which is here. So the proximal means the upper part of the tibia, and the medial is this side. She recalls instant discomfort in this area, which has unfortunately persistent, especially with activity. So this patient is a Taekwondo player. She has discontinued her usual intense regime of Taekwondo training. As a result, she is understandably need to get better soon, as she has some important events coming up. So this patient suffered from knee injury 6 weeks ago, and during these 6 weeks, she have constant knee pain in the medial side of knee pain. So that she cannot continue her routinely Taekwondo training. So for the physical exam, so the surgeon report, she has no demonstrable effusion, the tender to palpation over the proximal medial tibia flare, approximately in the region of pes anserinus tendon insertions, with somewhat lesser discomfort in the posterior medial joint line. So in PE, the tender is located in the region of pes anserinus tendon. And this tender is exacerbated by McMurray's test. So you can search online for the McMurray's test. tomorrow test. Yeah. It's positive, right? So this is a report from a surgeon. And the treatment plan is to do an MRI because this patient have suspicious of medial mancil tear. The surgeon think she may have pes anserinus bursitis and the posterior home medial mancical tear. So which means this part. So this is the MRI report. The MRI report will indicate mild capsular and soft tissue. Or edema. And postal medial knee. Injury. Yes. So this is the MRI report. So in this case, it indicates an injury for this structure. This structure is called pes anserinus. Pes anserinus. So the meaning of this is a goose foot. It's a goose foot. In Chinese, 鹅足韧带, the goose foot. So this tendon is a confluent tendon of 3 different muscles. So the first muscle is sartorius. Sartorius is a muscle in the anterior part of the thigh. Serratus. And the second muscle is gracilis. Gracilis is in the medial part. Gracilis, 骨薄肌. A third muscle is semitendinosus. Semitendinosus is in the posterior part of the thigh muscle group. So 3 muscles in different group, and finally confluent into the one tendon. So this tendon called pes anserinus. And this tendon have an insertion in the medial proximal part of tibia. So this bone is tibia. So the location is in the medial side of the knee. So any knee injury, if it's injured the medial side, it will cause this part injury. So that is the report says. The tendon in the region of pes anserinus tendon. So, based on this history, I think there are two reasons for the patient to search for the acupuncture treatment. One reason is she have undergone 6 weeks of standard treatment and have no good effect. So she need to search for some different therapy. And second reason is from the MRI, there's only mild oedema in this region. So which means there's no physical damage, which means the bone friction, the tendon tear. So which is obvious indication of surgery. The MRI have confirmed the injury is there, but there's no physical damage of the bone, the cartilage, and the tendons and the ligaments of the knee. So the acupuncture therapy will be effective. Yeah, this is the history. So in acupuncture treatment, I choose the following points. So the first group is called a 习武针。习武针 "习" means knee 5 needles. Five needles on the knee. Okay. Five needles on knee is 习武针。习武针 in theory, the 习武针 treat all knee pain to reduce the pain. Yeah, to reduce the pain. This is the first group. And the second group, I choose 下三黄。下三黄 means the lower 3 kings, which are 3 points. 3 points. They include 三阴交。and 阴陵泉。and 肾关。肾关 is an extra point. I will introduce it later. So the purpose is to reduce the oedema. edema. So third group, I choose 外观 plus 阳陵泉。So 外观 plus 阳陵泉 is a combination of 少阳. So the main purpose is to promote sanjiao fluid. Circulation. So the fourth group, I use 八卦. Yep. To regulate whole body. The whole body circulation. Yes. So in treatment, I usually use the 4 groups of needles. I treat this patient 5 times. 5 times. So after 1 month, so the first visiting to the orthopedic surgeon is in June 20. So after 5 surgeons, 5 acupuncture sessions, now we come to July 31 of July. So the patient go visit the orthopedic surgeon again. So the report is, so the surgeon says, in essence, she has no intra-articular issue at all. Her cartilage and menisci are both intact. She is obviously happy with this bit of information and she has improved substantially. Yeah, I do not believe there is anything else to be done for her. So this is the last report from a surgeon. So which means either the syndrome and the injury itself have all been improved, obviously. So which means the acupuncture have a very good effect for this kind of soft tissue injury. So later I will introduce these 4 groups of needles one by one. Okay, the first group of needle is called 习武针. 习武针 is, we know the 5 needles on the knee. So which 5 needles? We'll say this is the knee, yes? So the first needle is here. Just on the top of the tibia bone, there's a tendon. So the name is 鹤顶. 鹤顶. That is extra point. Yeah. There's an extra point. 鹤顶. The first one. The second one. The second one. It's called 西眼, 外西眼. Huaxian have another name, which we all know is 独鼻. Dubi is a point in the stomach channel. So it's located in the below the knee. You can feel an impression below the knee. So the third one is here. We call the 内斜. Nei means medial. Yeah. The medial part. Medial to Dubi. So which means below the knee patella bone, we can feel two obvious depressions below the patella bone. One is in the lateral side. There's a classic point we have learned is Dubi. And another depression is in the medial side. Medial side, we call it 内斜. So basically, these 2 points, we give them a name of called 西眼. 西眼 means knee eye. Yeah. There's a lateral one, the one in the lateral side, which is the same location with Dubi, and another in the medial side. And the fourth one, yeah, we all know, is 阳陵泉. And the fifth one is 阴陵泉. So this 5 needles is a combination to treat any knee pain. So the first group, I'll choose this combination. So for the 阳陵泉and 阴陵泉, there's one theory, one school. We need to use a long needle to penetrate the needle. To penetrate the needle from 阳陵泉 and point to the 阴陵泉. Yeah, penetrating needle. But using this technique, we need to find the gap between the 2 bones, which is tibia bone and the fibula bone. Yes. We need to penetrate the needle through the gap between tibia and fibula. So, which requires some good understanding of anatomy. But not everyone can complete this. But to me, I did this both. One is I try to penetrate a needle from Yang direct to Yin and the second choice is I just one needle on Yang and another needle on Yin Yes. Practically, I didn't feel any obvious difference. Yeah. So if you're not confident enough to penetrate, you can do two needles, one in Yang and one in Yin. So altogether, we get 5 needles. One is heading on the top of the patella bone. Another one, 独鼻, which means 外斜, and 内斜, in the medial side of 独鼻. And Yang and Yin. So this is called 细五针. And in 细五针, I tried both in the injury side and in the opposite side, which means during this treatment, we can choose to use another method called 偶刺. 偶刺. 偶刺 means needle the opposite side. Yeah, we can choose to do this, which means if this is the left knee, the injury in the left knee, here in the pes anserinus side, yes. We can choose the injury side, but for some reason, we can also treat the opposite side. So we can use 细五针 on the right knee. If the injury part is the left knee injury, and we can needle the right knee. It also have effect. So I try this both. So in the first treatment, I use the injury knee, and the second session, I choose the opposite side. And the third session, I choose the injury side again. Yeah. But in some cases, like the acute sprain, we will find the injury side is have obvious oedema, yeah, or bruise, so which is hard for you to needle on the injury side. Yes. In this case, we can choose 偶刺. We needle the same point on the opposite limb. Yeah, it provides similar effect. Yeah, I've tried this both. They both have good effect. Okay, this is the first group of needling therapy. We call it 西五针. 5 needles on knee. Yeah, in theory, this combination, yeah, will treat any knee pain. And also, we can choose 偶刺. Choose the opposite side. So the second group is called 下三黄. 下三黄 is the lower 3 emperors. Yeah, lower 3 emperors. They are a combination of 3 points. The location is here. This is the medial side of the knee. Yes. The first point is 三阴交. It's 三阴交. Yeah, as we all know. And the second point is 阴陵泉。The third point is an extra point. We call it 肾关。Extra point called 肾关. It's still located in the spleen channel. It's just around 1.5 寸below 阴陵泉. And we can press from the 阴陵泉, we press around 1.5 寸. We can feel a depression. It's called a 肾关. These three combination is known as 下三黄. So the main function of this combination is to reduce edema, to reduce any body fluid, any water retention, or dry the dampness. Yeah, if the patient has the severe dampness, yeah, which we use this combination 下三黄 to treat dampness. Why? Usually we treat dampness and edema and damp phlegm. Yeah, we will consider use points on the spleen channel. So why? The reason is the spleen. The spleen in Taiji, the spleen belongs to Taiyin. Spleen is Taiyin. So the spleen channel, the full name of spleen channel is the foot Taiyin channel of spleen. Yeah, the foot Taiyin channel of spleen. So Taiyin in Taiji theory, Taiyin belong to damp earth. Damp earth. Yeah, 太阴湿土. 太阴湿土, damp earth. So in 5 elements, 太阴 belong to earth. Yeah. And 太阴 is dampness. So usually we treat any syndrome related to dampness. We can choose this combination. 下三黄. Very common use. Yeah. So this is the second group. Okay, the third group. Yeah, is easy. Yeah, we have learned it in the school. It's a combination between 外观 and 阳陵泉. So in Taiji theory, they are all belong to 少阳. Yeah, 外观 belong to 三焦 channel. Yes. And the 阳陵泉 belong to the gallbladder channel. Gallbladder channel. both 三焦 and gallbladder all belong to, in Taiji theory, they all belong to 少阳. Yes. In theory, 少阴 and 少阳is related to the pivot. Pivot means the transferring between yin and yang. So this combination will promote 三焦 fluid circulation. So the 三焦 function is for the whole body fluid circulation. Yeah. Usually this combination can treat any fluid metabolism syndrome. Yeah. So at last, I would like to spend some time to explain the 八卦. So usually the 八卦 needling, we can use, in theory, we can use any point to apply the 八卦 needling. So usually, the most common use is on around the knee, right? Around the belly button, right? So, the belly button, in the abdominal region, we can divide them into 9 parts. Yeah. So we use this method in anatomy, in surgery as well. Yeah. This is the middle part, perinatal part, and the upper part, epigastric region, and the lower abdominal region. Yeah. And this hypochondriac region. Yeah. So in TCM theory, this 八卦 theory is developed from the Asian Taoism philosophy. So we name this 8 direction, except from the middle. We gave this 8 direction a name. The upper part is called Li. It's called Li. The lower part is called Kan. The left upper part is called Xun. The right upper part is called Kun. The left side is called Zhen. The right side is called Dui. The left lower region is called Gen. And the left right region is called Qian. These names present the different directions. So in needling, we can either directly insert needle on these regions, and we can also choose to insert needle on the side of navel, and to point to the direction. Yeah. This we can choose. Yeah. So usually we choose this one. Yeah. Because it's more safe. Yeah. Yeah, we all know on this region the needle insertion is very safe because physically they're just tissue with the fat tissue. Yeah. we have less risk to injure the abdominal organs. So usually we choose different directions and for different meanings. So in this case we choose these 4 directions. The first one is 巽. The second one is 艮. The third one is 坤. The fourth one is 乾. So in these 4 needles toward the 4 directions, which we have the meaning of the directions. So if some of you know the meaning of 八卦, we will know the direction of 巽. Why? Firstly, I choose 巽because this direction, the first meaning is wind. Wind is yin wood. Yin wood. So in TCM, what is the meaning of yin wood? It refers to any tendons, ligaments, and soft tissue, etc. Right? And joints. So in 5-element theory, this body tissue all belong to yin wood. So if we treat any issues about joint pain, like any arthritis, any injury, we can choose this direction. First one is 巽. The second one is 艮. The meaning of 艮is mountain. Which means young earth. This direction in TCM treatment have another function, is to stop symptoms. Which means any acute symptom, the combination of 八卦 needling, there's a high chance we use this direction. Good. We use it for stop symptoms. They can also use in some stomach problems. We can also use it. And also the young earth can be used to control water. So some water problem we can use. So the third one is 坤. The meaning of 坤 is earth. Which is yin earth. Yin earth may refer to any fluid dampness condition, or any condition with the spleen. So the similar function with 下层黄. Yes. This 坤. So the fourth one is 乾. The meaning of 乾is heaven. Heaven is young metal. Young metal. So in this direction, we can use this direction to treat some like a large intestine problem, or any head problem, headache and dizziness. Yeah, we can choose this part. Yeah. So after all, these 4 needles, we have a name to this combination. This combination, we have a name called 四鱼. 四鱼位. 四鱼位 means 4 corner. 鱼 means corner. Corner, way is direction. Yeah. Four corner directions. So usually we use this combination to treat the problem of 4 limbs. Yeah, and shoulder pain, knee pain, arm pain. Yeah, and any young problem like the problem in the hollow organs, the stomach, large intestine. Yeah. So we call it 四鱼位. Yeah. Remember this name? Yeah. So if you can, try to familiar with this 5 names. 5 names referring to 8 directions. Yeah. These 8 names of Bagua, which have different meanings. Yes. It's very useful to regulate the whole body circulation and the metabolism. Yes. So there's one thing we need to pay attention is when we use the Bagua needling, there's some students. The students have some feedback about this Bagua needling. So they say the effect of the Bagua needling all depends on the practitioner. So the patient who give me this feedback, who have experienced several practitioners, who is trying to give her the therapy using the Bagua needling, yeah, on his navel region. So her report is from some practitioners, it gives very good effect. As soon as the needle is inserted, she can immediately feel some like a circulation changing. But for some of the practitioners, she can feel nothing. Yeah, so only a needle insertion into the fat tissue. Yeah, which means have no effect. So I think the effect of Bagua needling, yeah, we can think about it. All depends on the practitioner's understanding of yin-yang theory, the 5 elements theory and the Bagua theory, yeah, and the Chinese traditional philosophy. So if you have deeper understanding of this, the more effect you can provide to the patient. Yeah. This is a real feedback from the patient and the student. Yes. Yeah. So today I share a case, yeah, of knee injury. Yeah. So the good side of this case is the patient provide a 4 reports from the Western medicine. Yeah, they have a report of MRI and the full history from orthopedic surgeon. So we can compare the different effect of a same patient who have undergone standard Western medicine therapy and needling, and acupuncture. So which is I think which is a good case. Yes. For the following sessions, I think since this session is in English, based on the non-Chinese speaking students, in the English session, I think it is better to introduce more about the Chinese traditional philosophy and their relationship with our TCM and daily TCM treatment. So try to make you understand more about the Chinese traditional philosophy. So in the Chinese session, in the Chinese lecture, I try to provide more information about the Western medicine. So in my Chinese lecture, I will spend more time in the explain of the disease, the anatomy, the physiology, and the clinical standard. Yes, in Western medicine, I try to make the Chinese-based practitioners to understand more about the standard therapy in the hospital and in the Western medicine system. Yeah, that is my plan. So if you have any question or any feedbacks, I'm more than happy to receive any feedback from you. Yeah, and to improve myself and my future lectures. Yeah, thank you.